morning, everybody. Hi, and thank you for joining this online version of the City Health Conference 2020. My name is Cinzia Brentari, and I am recording today from Italy, from home, the place where I've been working, like many of us, over the last couple of months. Working amongst other things on harm reduction projects. I've been involved in the harm reduction world, let's say, for almost 20 years, and this is why I will contribute to today's discussion just with a couple of reflections coming from my experience, let's say my journey with harm reduction. A journey which started in 2001 when I joined the European Commission in Brussels. And I first met harm reduction and the word harm reduction. I was working in a department of the European Commission which funded projects to developing countries on drugs. The drugs agenda of the European Union was at the time very much based on the two main pillars of drug demand reduction and drug supply reduction. And I clearly remember the words from my boss at the time of the European Commission. He told me that we were funding these pilot new projects on harm reduction, but we were not really wanting to have the harm reduction word included yet in our policy agendas. So those were still times where not everybody would accept even the term harm reduction. But the European Commission allowed me to get in contact with harm reduction in practice. Those are a few pictures which come from my early days at the European Commission. In 2003, I started missions in the field to visit harm reduction projects in developing countries. I went to Latin America first, Colombia, Mexico, the Caribbean region, and then I moved on to other organizations to work on projects in Asia, in India, and for many years in Iran, where I monitored harm reduction projects. And those are pictures which make me think very much of the core theme of the City Health Conference this year, which is a compassionate agenda. And I think compassion was one of the feeling that you could see in the eyes of these street workers here, outreach workers, people who would go out in the street and meet drug users, look up for them, find them, talk to them, listen to them, providing life-saving items like clean needles and syringes and condoms, and sometimes purely a sandwich of a cup of warm tea in winter times. And compassion was also something which the communities of people who use drugs used to look at each other, to take care of each other, and basically to stay alive. This was the main objective in some of the very harsh environment in which these people, drug users, were living and still are living today. So I fell in love with harm reduction at the time, really, and I started studying it more deeply. And I then learned a lot about the idea that harm reduction is a public health priority. Harm reduction saves lives, harm reduction works, harm reduction is cost effective. We used a lot the cost effectiveness element for a number of years to try to convince policymakers that it would make sense, even from an economic perspective, to invest in harm reduction, spend less money today, but invest in harm reduction so that you have a big public health gain in the future. So the public health priority was something we would look on in terms of research, in terms of producing the evidence, in terms of disseminating and sharing the evidence. We were working a lot with UN organizations, WHO, UNAIDS, UNODC. They were all compiling and disseminating evidence about the fact that harm reduction works. And this was very much important for my work at the time when I worked on prison health. I've had the privilege of running for a number of years European networks of third sector organizations, researchers, and prison administration working on health in prison, trying to discuss together on ways to improve the health of people who use drugs when they ended up in prison. And the harm reduction agenda was very much there. And the bullet point that you see in these slides Funnily enough, are bullet points which stayed the same for a number of years, and I would copy and paste this slide over and over again from presentation to presentation when I traveled around Europe to talk to prison administrations, to prison doctors, to harm reduction workers, to policymakers, to public health workers, and showing them the evidence that needle exchange could be easily and safely introduced into prisons, and that it was effective for the health of prisoners, the health of people who use drugs, but also the health of prison workers, that it was safe for prison staff, and that it was a gain for the whole community. And then moving on again, I realized that evidence is not enough. It would have been nice to convince our policymakers purely through the lot of evidence that we had. But there are two other core elements which are needed if we want to foster a harm reduction agenda, elements which are mentioned here. Funding on the one hand, core to fund harm reduction services, and what I call here political wisdom, and I'm not sure this is the right word, but for me, political wisdom means the capacity of our policymakers, of our governments to look for the future, to have a vision, to use that evidence to transform this into policies which work for the general interest. This is what we should be looking for when we think about policy making. When it comes to funding, the striking case which comes to my mind, because I lived it, I was working on that, is the case of needle exchange in prison in Romania. We had worked for many years to introduce this service in Romanian prisons. We had created the political environment. We had passed, Romanian colleagues had passed legislation. We, through international projects, we had trained prison doctors and prison administrations and peers in order for the needle exchange to start, which happened. And services were running around different prisons in Romania until the Global Fund money ended for Romania. Between 2010 and 2011, the Global Fund program stopped. And Romania is a clear case amongst the many others of a country which was not ready, of a government which was not ready to sustain the investment made by the Global Fund, which meant that most of the harm reduction services reduced substantially or stopped. And if I think of the years of investment to start a very difficult harm reduction service such as needle exchange, and the rapidity in which it was dismantled, you think that sustained funding is something which is really crucial, as well as political wisdom. And when I think about political wisdom, I cannot but think of my own country, Italy, where I moved back in 2009. And then I started working with the Italian harm reduction network and with third sector organizations here running harm reduction services. And I realized that really third sector organizations are still striving today for the recognition of the harm reduction agenda, and that we managed to introduce harm reduction services only recently in the basic minimum standard for services in the public health sector. And this nice black and pink campaign here, it's the campaign by Harm Reduction International, which looked at both elements, funding and political wisdom, because we called for a redirection of resources, a redirection of 10% of the resources which are devoted to the fight to the war on drugs by 2020 would have substantially helped in reversing the HIV/AIDS epidemic globally, which clearly, unfortunately, did not happen. And the human rights angle to harm reduction is something I learned more recently, again through my work as senior advisor to Harm Reduction International. Discrimination and marginalization of people who use drugs is something we've heard many times. They treat us like dirt, says these Russian drug users, but we have a lot of testimonies from people who use drugs about this. And I very much like the statement from Professor Paul Hunt, who's a former UN Special Rapporteur on the right to health, and for him, harm reduction stands as a clear example of human rights in practice. And this is very nice. It makes me go back to my early days and my experiences with those street workers and outreach workers. What they were doing then was really putting harm reduction in practice. And when we talk about putting human rights in practice, and when we talk about human rights with reference to harm reduction, we talk about the right to health, the right to non-discrimination, the right to equal treatment, the right to life sometimes. So we really need to keep the human rights angle as core to our agenda in looking to further work on harm reduction. And then we come to these difficult times, the COVID-19 emergency times, an emergency, a pandemic which has impacted heavily on the global agenda from very many different perspectives. It has an impact, of course, on people who use drugs. There is an increased risk for drug users and marginalized populations these days. There's been a heavy disruption of harm reduction services around the world. There will be an impact on funding with a redirection of donors' funding towards the emergency. So we really need to watch out so that core funding stays in place for harm reduction. And as I read through a number of authors these days, there's a lot of people who argue towards the idea that we should use this opportunity, this emergency time, as an opportunity to rethink, to approach our life and the world and the future in a more meaningful way once we will be starting to get out from this emergency time. And I think a combination of the elements that we've been going through today, and that we will surely listen from the other presenters to this meeting today, will be needed in order for us to look ahead with a clear focus on a harm reduction agenda. Thank you.